I don't know, he was just acting weird. And then I rang up my brother and said, do you know what's wrong with him? And he said, last time that happened, it was a tick.
17-year-old Lucas has arrived at the Bondi Referral Hospital SASH with the family Samoyed. The 11-month-old, called Polar, has suddenly lost control of his back legs and can no longer stand.
How long ago could he not walk? When did you notice?
Probably about 3 or 4 hours ago was when I first noticed it.
If a paralysis tick has burrowed into Polar, emergency vet Lisa Chimes needs to find the killer parasite fast.
Basically what happens when they're bitten by a tick is that it causes paralysis, so the toxin goes into the bloodstream and it binds at the ends where the muscles meet the nerves, and it paralyses them. So it usually starts at the back legs and it moves up. It's all right, sweetie. I know. It's life-threatening because it can paralyse the breathing muscles, so they won't be able to breathe anymore. Let me just give him a cuddle in the hip. It's okay. It's all right, sweetie.
The bewildered Polar has to be transferred to the treatment room.
He's got so much hair and you need to search in all the little orifices around his bum, in his ears, around the mouth, so he's going to need a full haircut to try and find the tick. It's too early to tell exactly how he's going to do. His blades aren't even cutting through half the hair. There's no sign of the tick here, so it's obviously moved on somewhere else. Got to find the big grey female. So we shave until we find it.
Good boy, steady.
Look at this.
Vet nurse Victoria is called in to finish the job.
Never get a vet to clip. Oh my God, you've put me to shame. It's all right, honey. I'm in the firing line.
Anti-serum is slowly running through Polar's system to try to neutralise the tick's poison. It works just like anti-venom for snake bites.
All right, sweetie. Okay. He came in roughly 2 to 3 hours ago. He could walk on his front legs. Now he can't walk on his front legs, so the paralysis has extended up to the front part of his body already. She's nearly done.
Boy, you're a good boy. Easy, mate.
I can't imagine how hard it would be to feel like this.
Easy, baby.
Good boy.
Stop.
Polar is becoming more distressed. The anti-serum could take up to 24 hours to start working.
Calm down. So he's started to breathe up a little bit more. His oxygen levels are reading slightly lower than they were before. So at this stage, we're just going to try him with a little bit of oxygen and see if we notice any improvement. Good boy, you're so brave.
Despite the extreme measures, unfortunately, the tick hasn't been found.
We're just going to keep on searching throughout the night. We don't want to stress him out too much more, so now what we're going to do is just leave him in the cage, let him have some rest, give the tick anti-serum some time to kick in and see where he's at again in the morning. I'm sorry for your haircut. Hey. Yes, he says, I'm very embarrassed. Just have a nice sleep, Paula. Paula! Hi, sweetheart. Look at you. Hey?
At Bondi's Referral Hospital SASH, 11-month-old Polar is still fighting the effects of poison from a paralysis tick.
He was searched throughout the night for more ticks. They didn't find any others, but he doesn't look like he's got any more. You want to try stand for me? Oh, sweetie.
It seems the tick has disappeared, but Polar still has a long way to go.
He's not completely out of the danger zone. I guess his swallow reflex is not perfect.
Boy.
I know you don't like your mouth being touched. There always is the risk that he can inhale some of his food, so we have to just feed him very slowly. And some chicken? Hey? Is this better than dog food? Come on. Ah, he's a bit spoiled. This is a really quick recovery for a tick bite. Honestly, I usually find it takes about 24 hours for us to notice some improvement, and in his situation it's been less than 12 and he's already made a dramatic change. How are you feeling about your new haircut? Hey? Feel like a new man?
But the last step for Polar before he's allowed to go home is to prove he can stand up and walk.
Collar's too big for you now, huh? You've no hair there.
It's time for Polar to leave Sash.
I'm here to pick up Polar.
The poison from a potentially lethal tick bite paralysed both his front and back legs. Despite his rapid recovery, the Samoyed's still having a bit of trouble.
Hey, it's too slippery. Come on, Paula. Come on, who's that? Come on. Who's there? Hey?
Quentin is the older brother of Lucas, who rushed Polar in to the emergency hospital.
Tell him he's saved his dog's life.
Yeah, definitely did.
You're happy to go home? You are? You're such a good boy.
From now on, Polar must be checked for ticks every day. This has been one lucky escape.
I was really surprised first at how he changed. His coat was completely gone. Like he went from looking like a polar bear to almost a lion. But it's just good seeing him alive, happy, strong.
It might be an idea that they keep him clipped. I won't tell the Samoyed Society that, but it's just going to make their lives a lot easier and help him out and hopefully prevent this happening again.
No, he looks kind of like a poodle. Gross.
Oh, Scott, have you seen who's coming in today? Your favourite?
The clinic's most feared patient is booked in later today.
It's always quite concerning when you see "must be muzzled" on their patient card.
Bright red. Yes, gauntlets at the ready, but fingers in your pocket.
Yeah, awesome. Every 6 months or so, the word "bam bam" will flash up on my screen, and yes, it's always a day that you know that the adrenaline is going to be flying high.
Just a short distance away at her home in Richmond, Sheena is getting Bam Bam ready for his outing.
What are we going to do with you, eh? You who doesn't like to get groomed.
Hard to believe this sweet, shaggy angel turns into a demon when confronted with a set of clippers. Not even Sheena can brush him.
You feel really defensive because you know he's a wonderful dog and you know his gentle side, you know how loving he is. All they see is this gremlin that comes in the door. It's really embarrassing.
Come on, Bob. Come on. Come on.
Bam Bam's bitten his owners. The last time Sheena's partner brought in the dog, we had to send him to A&E. That's how serious this dog wants to injure anyone that is doing something that he doesn't like. Morning.
Good morning.
Morning.
How's trouble?
He's wound himself up quite badly
Oh, is he?
already. Yeah, he's shaking like a leaf. Can you see him?
Okay, oh dear.
Yes. You'd have thought by now he'd have realised you're not going to kill him. No,
The moment
no,
of
he's
truth
been
has
very
finally
happy.
arrived for Scott. His nemesis Bam Bam has entered the building for a haircut.
Sometimes when I take him in, he is very long and hairy, and it's not because I'm negligent, but I can only have him anaesthetised a couple of times a year. People say to me, surely you can take him to the groomers and just give him a sedation. And I'm like, no, you don't understand. Because even under sedation, he's still growling, right? And he's trying to fight for his life. So whatever anybody did to this dog, historically, they did a real number on him.
So far, Scott is the only vet who hasn't turned Sheena and Bam Bam away.
Mum's a bit upset today. She doesn't like to bring you in, you know that. The reason why Scott's been so amazing is he's never thrown me out with Bam Bam, and what Scott never did is he never judged me. Bye, baby. Bye, hon.
Bam Bam, come on then, buddy. Let's go. Good boy.
He's shaking, look at him, poor little thing. He doesn't realise that I have to do it, because he's a dog, he doesn't understand. Please give me a dog back at the end of the day, because he means so much to me.
I'll look after him well, and we'll give you a call once he's woken up.
Okay, thanks a lot. See you later.
Okay. Bam Bam. No.
But as soon as Scott and Bam Bam are alone,
No.
hostilities break out.
No. If he came in growling, everyone would know where they stood. Don't be nasty, come on. But because he comes in very calmly and then launches within seconds, he is an exceptionally dangerous pet. Oh, no. Don't be horrible. No. Stop that. I think we're going to need some more drugs today. Right, so we'll do our usual technique. Okay, I'll slide this through the door.
Scott has to literally treat Bam Bam like a wild animal to sedate him. It's primitive but effective.
Okay, you've got him?
I've got him.
It's all about fear. He's fearful of me and I'm definitely fearful of him. Okay. See what happens. Come on. Ooh, yowza. It's always a day that you need a stiff drink when Bam Bam comes in. A bit dozy. Yeah, those drugs kicking in. Right, okay.
Finally, Bam Bam appears to be docile enough to be handled.
Just always be careful. You remember this guy actually growls in his sleep.
Even with the muzzle on, your adrenaline is pumping high.
We should keep a very close eye on the depth of this anaesthetic for our safety as well as his.
My heart's pounding. I'm shaking a little bit. I've still got to do my job as well as trying not to get eaten, so nerves on tenterhooks.
So, do you want to do the fur and the feet?
Yep.
And I'll do the body bits.
All on you.
While Bam Bam is under, Sheena has also asked Scott to clean his teeth.
Have you done the hairdressing before or him?
No, can you tell?
Yeah.
I've never claimed to be a groomer. A shearer, however.
He's a very, very, very good vet because he puts animals first. He's empathetic to the owners, but what I see about Scott is that his real concern is for my dog, you know, and to make sure that he's okay, and that means everything to me.
Dental's all finished down this end.
Scott's now completed Bam Bam's dental work, but Emma has discovered something worrying.
Scott, he's just got a bit of a situation on his tail here.
Whatever it is, it doesn't look very nice. To find something that looks that angry and that nasty is a massive cause for concern.
The problem is the mass is so large that once removed, it will leave a wound that will be impossible to close. A mini amputation is the only answer.
Hello, Scott.
Hi there, Sheena, how you doing?
I'm okay.
Okay, so look, that tail lump.
It came up very, very quickly.
Scott's now seeking permission from Bam Bam's owner, Sheena, to go ahead with surgery.
So I always say it's best that we remove it straight away.
What do you mean?
Actually take the end of his tail off.
Oh my goodness.
Sometimes being a vet is about offering up decisions which are difficult. And to say I'm going to take a section of your dog's tail away, no dog owner is going to feel good about that. There's nothing good about that at all.
Is he going to be in a lot of pain?
I don't have any concerns regarding pain.
Okay.
Okay, all right, trust me, and I'll give you a call as soon as he's woken up.
Okay.
All right then, see you later.
Thank you.
Bye.
As soon as Bam Bam's grooming is finished, Scott takes him into theatre to remove the tip of his tail.
Okay, so you can grab the tip of that.
Emma and Scott have been working together for 7 years.
A lot of people do say behind every good vet is a good vet nurse. We have such a relationship during a surgical procedure or during an emergency situation. I know what he wants before he wants it.
I don't want to take off any more tail than that. Send that away and we'll just see what the pathologists say.
A sample will now be sent to the lab to find out if the lump is malignant.
Good boy. Let's put you back in there while you're still being a good boy. Sheena's a great owner, but I suspect that she's going to be in bits when she comes to pick up Bam Bam, and I just can't reassure her. At the moment, I just simply don't know. It could come back as something absolutely fine. It could come back as really bad news, so we just need to wait and see. It's one and only time I get to pet you. It's quite nice.
Hi, Sheena, you alright? Let's get your boy back.
A short time later, Sheena and her partner Neil arrive to pick up Bam Bam.
Come on then. Good boy. That's it. Good lad.
A sample from the lump on his tail has been sent to the lab for analysis, but it will take several days to find out the results.
Here we go. Out to see Mummy.
Sheena is still very shaken.
B. Oh, he's coughing, is it? Because he wants to get to me.
I knew she'd taken it badly, but then to see the reaction of her to actually collapse on the floor like that, I've never seen anything like it. How are you feeling about everything?
It's scary. It's really heartbreaking. And I had to take a couple of tranquilizers that then made me really think it was a dream after I heard about the tail.
So we'll be sending it off to the pathologist. I know you're worried about it, but it's something that we'll have to just hold fire on concern for 3 days and wait until that result comes back.
Okay. Taking a little piece of him off is traumatic. He doesn't understand it.
Take care, all right, no worries. Fingers crossed. The news is going to be good for her. See you, buddy. Hi, Sheena, how are you?
Hi.
Good to see
As
you.
for Sheena, she's been anxiously waiting for Bam Bam's lab results.
Grab a seat.
It's been 3 days since Scott removed a nasty cyst from his patient's tail.
Oh, he kind of knows who you are.
Already not so keen, is he?
No, he's not.
I've not got a scalpel on me, I promise.
Come on, Bubs.
I've got some good news for you, okay?
Yeah.
And that the results have come back that the mass is benign. So, in other words, nothing nasty, nothing to worry about.
I'm so relieved.
Yeah.
Thank you so much.
No worries.
And you know how much I love this dog. I'm so happy. Are you happy to hear that?
Sheena reacted brilliantly. You know, she's massively relieved and she can go on living with Bam Bam for a very long time and Bam Bam can go on tormenting me. I never thought that I was a very good dog stylist until you now have matching haircuts. I must have done something right.
Funny.
Well, next time I do them, you should come in. We'll do a 2-for-1 offer.
Absolutely. That would be really, really nice.
Great to see you.
You too. Thank you so much.
My pleasure.
Really
My
appreciate it.
The hot summer's day has taken a terrible toll on 4-year-old Titch.
It's about 35 degrees today. Titchy's been outside. She's really overweight. She's really, really hot. She's got heat stroke. Her airways are closing over. She's going blue, which means she's not getting enough oxygen around her body. We're trying to give her some oxygen with a mask, but it's making her panic even more. Okay.
No, darling.
Once we've got an IV catheter in, we can give her some sedation. She's got a tube in to help her breathe and help her actually get air in there. We'll get some wet towels as well, please. A dog's normal body temperature should be no higher than 39. Hers is 41.8, so her brain is cooking.
At reception, owner Janice and her daughter Lena are desperate for news about their cherished pet.
You can't find Mum without Titch. If Mum goes up, even just to go letterbox, Titch is there carrying her dog bone.
I mean, she follows me everywhere. Yeah. And it's strange just, for her to be here. It's very stressful. I just hope that she pulls through tonight.
Let's put her on 100 mils an hour. Her body temperature is so high that it can cause all her organs to shut down. The top priority now is getting her temperature down, but if we drop it too suddenly, then that can cause her to crash as well. Let's wet her, because she's still cooking. She's 41.4 now. Got to get her body temperature down, otherwise she can suffer brain damage and multi-organ failure. Andy, just make sure you keep her tongue nice and moist, because she'll cool from there too.
Finally, Titch is showing some signs of improvement.
Yeah, we've got a really slight reduction in temperature. It's the first one we've seen. We're just going to wet her with some lukewarm water. We don't ever want to use iced water on her because it can drop their body temperature too quickly. It's about doing it gradually, monitoring it really closely and making sure that we're dropping it slowly but surely.
Distraught owners Janice and Lena are allowed in for a few minutes to comfort her.
Oh, my baby.
I love Titch, but Mum and Titch, you can't even describe what they have. It's so strong. It's sort of like mother and daughter. I doubt she'll be getting any sleep tonight. She's okay, Mum. She's in best care. You be a good girl. Thank you.
It's okay. So we're not out of the woods yet, but her body temperature's come down. We'll call you if we have any problems. I think they were just so shocked by everything that's happening. It's all very overwhelming and it must have been a pretty scary thing to see.
Thank you.
That's okay.
Thank you so much.
This is definitely one of the hardest kind of cases to deal with. It's when I want to be able to tell an owner that I'm going to get their pet better, but I can't. She's so overweight.
Titch is still in intensive care at SASH. Lisa is certain her obesity has contributed to this critical case of heat stroke.
Titch is morbidly overweight. She's 21 kilos. I mean, she should be between 13 to 15 kilos, and that combined with her really thick hair coat on a hot summer's day puts her at huge risk.
Removing Titch's fur will help her maintain a normal body temperature.
Hey, baby. We're just slowly waking her up. I don't want her to panic too much, and I just hope that she can breathe on her own without having difficulty. She's not looking great at the moment, is she? What we're going to do is put a little tube in her nose to give her some oxygen. The most important thing now is just to leave her alone, not stress her out too much, and just fingers crossed she doesn't have to be re-intubated. Another episode of stress and panic could be the difference between her making it through the night or not. Good girl, Titch. Titchy. Hi, puppy girl. Hey. You ready?
Titch has pulled through overnight and survived her deadly case of heat stroke.
I know. Oh, it's not easy to walk around like this, is it?
But Lisa is concerned the overweight family pet could suffer a relapse if she doesn't go on an immediate diet.
Good girl. That's the way. In Titch's case, obesity is really threatening her life, and unfortunately in Australia we see obesity as probably one of the biggest health problems in our pets. I'm Lovey. It's our animals that don't have the willpower, they don't have that common sense to know that being overweight is bad for them. Come, Titch. Often it gets to the point where you see your animal every day, you don't actually realise how overweight they are. She's looking pretty sheepish. She's seen the numbers on the scale, she's got the motivation now. I'm expecting to see a big improvement. Come on!
After surviving a life-threatening case of heat stroke, Titch is back with her relieved owners, Janice and Lena.
I'm so happy to see she's all right. You're going to go home. You're going to go home.
So we've done the weigh-in today.
Yeah.
22.2.
Yeah.
So we need to get her down to about 13.
Yeah.
So she's got about 9 kilos to go. That's like half her body weight.
I've got a big job, haven't I? You know, I've got to keep her on a diet. She's got to lose some weight. Of course, I spoil her in other ways, you know, TLC and all that. Lisa, this is for you and your staff.
Thank you so much. That is so lovely.
I don't want anyone else, you know, for their dogs to go through that because it is upsetting. So, lessons learnt.
All right. Off you go.
Thank you. Bye, Lisa. Bye.
This is Ellie.
Hey, sweetheart.
Ellie's been retching for like 24 hours.
Okay.
And Mum's extremely worried about her.
On the Gold Coast, unwell little rescue cat Allie has been brought in to Alex.
Hello, sweetheart. You're a beautiful girl.
Allie's owner Shirley is a keen sewer, and when her precious Allie started suddenly dry retching, she instantly became alarmed that the curious cat may have swallowed a needle or thread.
Has she ever done anything like this before?
No, she hasn't. No.
She's been pretty healthy up to now?
She could have snuck in there and got a bit of cotton, maybe.
Okay.
I thought, oh, she'd be right in the morning, but no, she was doing it all during the night.
So we've got to find out.
It's just not like her.
Yeah. We'll take really good care of Ellie. I'll let you know as soon as we find anything.
Okay, that's great.
Okay.
Thanks a lot.
What I'm worried about with Ellie, she may have swallowed a bit of thread or needle and it's now got stuck. And if it is something like that, we need to find out pretty quickly. Okay, let's have you out and we'll check you over. I know you're a bit worried. Okay.
Allie is agitated, which is making it tricky for Alex to do a full examination.
Come on, sweetheart. Are you all right?
I can tell that she's quite nervous, so we're going to need to go really slowly with this little girl.
Oh, can I have a look?
Oh, good girl. Okay, well, I can't see anything obvious there. Feel around her neck. So when she's retching, you know, she could be trying to bring something up.
Or maybe it's just
stuck in the back of her tongue.
Yeah.
Listen to her chest as well. Yeah, Ellie, good girl. Good girl. Cats do not like being in hospital as a rule. It's noisy, there's dogs barking, and it just makes them very uncomfortable. I think she's getting the limit of what she's going to put up with, hey?
Yeah.
She's getting a little bit stressed out, so I'm going to give her some sedation, and then we'll pop her in a bed and let her settle down for a bit. This will just relax you a little bit.
If Ali has swallowed a needle, Alex needs to find it quickly, but she'll have to wait until the scared little cat is more relaxed.
Good girl. There you go. Good girl. Look at you. Hey, Ellie. Come on, sweetie. Little girl. Just a little sleep, okay? There we go. That's better.
Ali has been vomiting and retching for 24 hours.
Not a lot of room down there. It does look a bit red on the roof of her mouth there. I'm just having a look down Ellie's throat at the moment, and it all looks pretty normal. Definitely no string under her tongue, no thread under there. Sometimes the thread can get caught under, but that all looks fine. It's not uncommon to see a bit of grass under there, but there's nothing there.
Ali's owner Shirley is devoted to her precious little rescue cat.
She's a friend, somebody to talk to when you're by yourself. She meows and talks to me in her own way. She means a lot to me.
I might put that somewhere for safekeeping. The next thing now is to take her through to X-ray. If Ellie has swallowed any metal, like a needle or a pin, it'll show up as clear as day. I'm going to get you sorted out and get you home to your mum. But if it's stuck somewhere in her throat, it could cause major trauma. Here we go, sweetheart. You really want to get everything from right at the top back of her throat, right down to her stomach, really. You ready? I can see a microchip there, and I'm really looking for something along here that looks like a needle in her throat. Yeah, that looks okay. That's good. That's good, Ellie. You haven't been eating any needles by the look of it. It's good news. There's no sign of any metal object either in her throat or in her stomach. It doesn't really explain why she's doing this retching. The mystery of Ellie continues, so I'm going to take her back out to the treatment room. Just get her back here. Good girl.
With a sewing needle ruled out, Alex is now starting to suspect another possible reason for Ali's dry retching.
So we haven't found anything, and it makes me a little bit concerned about the possibility of a tick. Tick paralysis is really common in this part of the world, and if Ellie has got a paralysis tick there and we don't find it, then that could be fatal. That retching is a sign that her throat's becoming paralysed. The only way we're going to be sure that there's not a tick there is to clip all the hair off. It's just too risky.
Alex wants to make absolutely sure a deadly tick hasn't burrowed deep into Ali's fur.
Oh, it's all coming off, Ellie. We've finished clipping all of Ellie's hair off. She looks like a very different cat. No tick, so that's good. So I reckon let's get her back to bed. Come on, beautiful girl. I'm relieved there's not a tick, but the mystery with Ellie continues. Hey? Waking up? I'm going to let her rest now and come back and check on her in the morning. Good girl. Hello, you awake? Oh, you're looking very bright.
Next day on the Gold Coast, Alex has some early morning good news.
I hear you've eaten a whole bowl of food overnight. When I see Ellie this morning, she looks great. She's had no more retching, and I think she's ready to go home. You do look a bit different. What's your mum going to say?
Despite x-rays, a thorough physical examination and shaving her for ticks, the reason for the 5-year-old's sudden dry retching is still a mystery.
Hop in, good girl. There you go. Okay, let's go take you to your mum. Although we don't know what caused Ellie's retching, I think Shirley is going to be very happy to see her. I know how much this cat means to her. Now, do you recognise your Ellie in there?
Oh my goodness, darling, what have they done to you?
Yeah, even her collar looks a bit big now.
Is it darling?
It'll grow back. Pop in, good girl. She's still a bit of a mystery, but I think let's get her home.
Yes.
See how she goes, and hopefully, no more problems.
No.
This is Boston.
On the Gold Coast, German Shepherd Boston has been rushed into the Animal Emergency Service after his owner found him on the floor, unable to walk.
Hey, big man.
Vets Dr. Alex Hines and Dr. Gerardo Poli need to urgently find out what's wrong with this distressed shepherd.
The owners came home, or they were away last night, and they came back this morning and found out he couldn't really walk properly.
Oh, his breathing sounds a bit noisy too.
Yeah.
So just not walking properly, anything else?
Yeah, as far as I'm aware, I think they think it's a tick.
Okay. Paralysis ticks are so deadly because they inject a poison that causes widespread paralysis, not only of the back legs, but also of the breathing muscles, and that's life-threatening. I don't know how we would ever find a tick with all this hair.
Should be a prize for the person who wins, eh?
Who finds the tick?
Yeah.
Gosh, it's hard to even get your fingers down right down to his skin. Boston is showing all the signs of a patient severely affected by tick paralysis. Every breath is laboured, he can't stand, he's in real trouble.
If left untreated, tick paralysis can cause death in dogs in as little as 24 hours.
Okay. Oh, it's okay. I know, so many hands over you, mate, so many hands. Just back, lots of pats.
I think I can feel something.
Oh, if you found that quick, you must have magic hands.
Oh, there we go. That's a pretty big tick there as well. Ouch.
Oh, it's still moving, its legs are moving.
You're right to hold him still. Let me see if I can pull it out. This might hurt a little bit because his skin looks really sore around here. Good boy, Boston. Oh, God, this thing doesn't want to let go. Oh, I'm sorry, mate. Good boy.
Wow, it's amazing how something that small can have such a deadly impact.
Yeah, it's pretty incredible, isn't it?
He's such a big dog.
But that would be enough to cause the kind of paralysis that he's showing. I think he'd benefit from some sedation, wouldn't he?
Yeah.
It's just, even to help that upper airway breathing. Now that we've found the tick, it's vital that we get Boston onto some oxygen because I can see that he's already suffering from breathing paralysis. And then we can start the tick anti-serum. We're still going to have to clip all his hair off because we don't know that there's not another one there. But in the short term, he really needs the tick anti-serum because the toxin is circulating around his system at the moment. And the quicker we get the anti-serum on board, that will allow it to start neutralising the toxin. Come on through.
Before starting treatment, Alex is bringing through owners Rebecca, Wade and little Harlow to say goodbye to Boston.
You couldn't go and not say goodbye, I think, and especially for my little one. Got to give him love and stuff like that and make sure he's okay before we leave.
There he is.
It wouldn't be home without Boston. He makes our family whole. He's the best dog. He's just so good with our little one. She climbs all over him and he's just so patient with her and loves her. I feel like with dogs, when you look into the eyes, you can kind of see what's going on and he looks very sad, struggling.
He looks sad.
He's a bit sad, yeah. Big cuddle and kissy, say goodbye.
Okay, guys. So see you soon, Boston. I really want to clip Boston's hair to be sure there are no other ticks, but he's too unstable. We're going to have to leave him for tonight, and tomorrow morning, hopefully he'll be well enough that we can do the clip. I'm really worried about him, Drodo.
At the Animal Emergency Service on the Gold Coast, 4-year-old tick paralysis patient Boston has taken a turn for the worse.
We've given Boston sedation, and that's helped, but his oxygen levels are dropping. I want to get the tick anti-serum on board, but at this stage, I have to get him stable. His oxygen levels are dangerously low. Come on, Mr. Boston. Hey. I'm becoming concerned that we're going to have to intubate him, take control of his airway, and put him on life support. He's really gurgly. Just wondering if we even got to suction him, even in his mouth. Hear that? He's real gurgly. We try an oxygen mask, but Boston's fighting it. It feels claustrophobic. I know we're going to need to put a nasal line in if we're going to help him with his oxygen levels.
This is definitely better than him just having a mask in front of his face he doesn't tolerate. And it's much better than him breathing room air, so he needs this.
Boston's oxygen levels improve and we don't have to intubate. We're going to wait to clip the rest of Boston's coat. We know there was one tick, there could be more, but at the moment the priority is to get the tick antiserum on board. Yep. Okay, that's running. Once that's into his bloodstream, neutralising the toxin, I'm hoping we'll get him to turn the corner. You can hear that noise that he's making. Each breath is taking extra effort, and that's a real worry. If his breathing slows down, then that's where we start to need to intervene, and we may even need to take over the work of breathing for him. Oh, mate. There's not a lot more I can do for Boston right now, but I am really worried. I'm going to be checking up through the night, and I can't help thinking about that family at home who are just hoping he's going to pull through this. It's touch and go.
There we go. Okay, good boy, Boston. Hey, it's quiet in here, mate.
At the Animal Emergency Service on the Gold Coast, Boston's condition has worsened. The German Shepherd is battling deadly tick paralysis, and Gerardo is deeply concerned.
Boston's pretty serious at the moment. So what's happened is the toxin has still had an effect, and the antiserum mops up the toxin in the bloodstream, but there's still toxin bound to his nerves, and that's his own immune system will have to get rid of that over time. So generally what happens is a little bit of a deterioration over the next sort of 6 to 12 hours, and he's kind of deteriorated quite rapidly.
Boston has been transferred to the intensive care unit as his condition is now critical.
The nursing care is a bit more intensive, so hopefully that's enough to keep him stable, keep him comfortable, so we don't have to progress his care into mechanical life support.
Oh, Boston.
At the Animal Emergency Service on the Gold Coast, German Shepherd Boston's condition has continued to deteriorate.
You're really paralysed now. What happened? It all just went downhill. Your family's going to be so worried about you. We knew that this could happen, Boston, hey, but I was really hoping it wouldn't. But you definitely are worse than yesterday.
Alex fears the poison from a deadly paralysis tick may have done too much damage before the antivenom could take effect.
He's now got 2 oxygen lines in. He's definitely still putting a lot of effort into breathing. We're worried about what we can hear on his chest sounds, and we think he might have aspirated, so we think he's developed pneumonia. So we're going to want to take some chest x-rays, and then we'll know how bad this is. Good boy. In we go, Boston. Good boy. It's okay.
Okay, big fella.
All right, we're ready.
You all right?
Boston's x-ray, it doesn't look very good at all. What I'm seeing is almost complete consolidation of the lung. This is pneumonia on a massive scale. This has added a whole level of complexity to Boston's condition. It means that not only is he dealing with the tick paralysis, but he's got a severe pneumonia, and this could be the part that's life-threatening now.
With paralysis tick patient Boston's health deteriorating, the decision is made for Vet Elise and vet nurse Natalie to go ahead with clipping his fur in search of further ticks.
Poor Boston, he's now got paralysis and pneumonia. We've started antibiotics for the pneumonia, but the next step is to clip this hair off. We've got to make sure there's no more ticks.
I'm amazed that they found the first tick under all this hair.
Boston is now at the stage where he's completely paralysed in his body. He can lift his head, look around a little bit, but that's about all he can do. What that means is we have to help him with all his bodily functions. He can't even go to the toilet on his own. So we're going to need to put a urinary catheter in. We have to put cream in his eyes because his blinking is affected. All these things become paralysed as part of the condition. I'm worried there could be another tick there. 10% of patients have a second tick. And if he has a second tick somewhere hiding in this big furry coat, then it will kill him.
Boston's owners, Beck and Wade, have come for a visit, desperate to see their sick boy. But a decision has been made to keep them at a distance.
It's extremely hard for owners not to be able to come in and visit when they have tick paralysis, but we have seen animals before, like Boston, that are just coping okay on their own, that when they see their owners, they get so excited and their bodies just can't cope with that extra bit of stress. So, yeah, you know, you always think they're going to be so much better coming in and seeing you, but actually in this case, it can be really dangerous for them.
He's getting all his hair off, all saying, yeah.
Felt so sad.
Yeah.
So we were obviously just hoping to go see him and just give him a cuddle, make sure that he was doing okay, and to reassure that we're still here and, you know, hoping for the best for him, sort of thing. And I don't know, didn't know really what to expect. We got lots of phone calls last night, which was really good. Just kept us, you know, in the lurk and know what was going on. So, yeah, we just wanted to see an improvement. So what sort of journey do you think he's going to be on?
The pneumonia, to be honest, has set him back a little bit.
Okay.
Yeah. Because it's just given him another thing to fight. Okay. So it really is a matter of just watch and wait a little bit. There's only so much we can do for him, do you know what I mean?
Yeah.
And a lot of it's going to be up to Boston to fight this.
I feel very nervous, constantly just anxious, because we just don't know what's going to happen, because obviously he's got pneumonia as well. So he's got an extra thing he needs to fight and get through. So Boston's not out of the woods. It's sort of touch and go.
The clip is over. It was a marathon effort, but well worth it.
And we're done. Good boy.
Good boy. No more hair for you. And we didn't find a second tick?
No, we didn't find any additional ticks.
Okay. I feel much better now the hair's off. We know for sure it's just that one tick that was causing the problem. So I think at this stage, we've really done everything we can for him. He's had his clip, he's had his tick anti-serum. It's really up to Boston now to fight this and get better and get home. Yeah. Hey, Boston. How are you doing this morning? You're still on your oxygen by the look of it.
On the Gold Coast, tick paralysis patient Boston is still in intensive care, and Alex can't relax just yet.
It's been 2 days since Boston came into intensive care. It's good to see that the paralysis is wearing off, but the pneumonia, it still has him in the danger zone. That breathing still sounds a bit rough, hey, mate? Hey, you just look tired. How are you going with your walking? I just wonder if we might give you a little bit of a trial around and see if you can get up and about. He's blinking and he wasn't able to blink when he first came through into the ICU. So those things, as they improve, they tell us that it's less the paralysis that's holding him back at the moment and more the pneumonia. You going to show me what you can do? You can come for a little walk? Come on. Good boy. That was really good. Hey? Take it slow. Oh, you're off. That's great. Good job, Boston. Yeah, there's not much of you under there. Now you've got no fur. Oh, no, don't go check out the other patients. If you're walking that well, you might even be up for some food pretty soon. Good boy. It may not seem like a good thing to see a dog wee inside, but this is really good for Boston. It's an important step in the recovery of tick paralysis because it really shows us that paralysis is starting to wear off and he's able to resume those normal bodily functions on his own. So good on Boston for having a wee. Is that your bit of exercise for today? Do you want to hop back into bed? I think you'd be better off in bed. Good boy. You sit down. Oh, yeah. I know. Get you connected to your oxygen again. I can't even think about Boston going home until he's off the oxygen and breathing on his own. Right now, he's a long way from that.
You're feeling much better now, aren't you, Boston? Hey, you're such a good boy. Hey, you want to go home today? That'll be pretty exciting. You're going to see your family again. Good boy, yeah.
It's been 5 days since German Shepherd Boston was bitten by a deadly paralysis tick and left fighting for life. After a week in intensive care, he's finally on the mend.
Hey, how's it going?
Hey, yeah, really well. He is doing fantastic.
So what's the verdict? Do you think he's good enough to go home?
Yeah, I think he's ready to come home. He is off oxygen, he's had some dinner, and he's up and walking around.
That's so good.
Hey, Boston. Hey? Are you a good boy? Thank you. Thank you, buddy.
I am so thrilled that Boston is going home today. There were moments where I wasn't sure if he was going to survive, and just being able to take him out to his family, this is going to be incredible.
Hello.
Does he look a bit different?
Yeah, he looks a lot different.
He's so different.
Buddy.
Oh, boy.
Hey, buddy.
Yeah, what do you think, Harlow? Did you still know it was Boston?
He knows Boston?
Hello, boy.
That's honestly, that's the happiest he's
He looked a bit unsure. He was like, oh,
Hey, boy. There's a boy. Okay.
He looks so different. But he's still our baby. Yeah.
It can be really tough as an emergency vet. It's long hours, it's tough work, there's big decisions to be made. But seeing patients like Boston go home today, it's so worthwhile. This is why we do it.
Eddie, you be a good boy. Are you going to take him out? Yeah, he's not going to be...
not that way.
This way, Boston. Come on. That's a good boy.
Yeah, hold on tight.